Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
Which of the following techniques for administering the Mantoux test is correct? 1. Hold the needle and syringe almost parallel to the client's skin. 2. Pinch the skin when inserting the needle. 3. Aspirate before injecting the medication. 4. Massage the site after injecting the medication. The correct answer is 1. The Mantoux test is administered via intradermal injection. The appropriate technique for an intradermal injection includes holding the needle and syringe almost parallel to the client's skin, keeping the skin slightly taut when the needle is inserted, and inserting the needle with the bevel side up. There is no need to aspirate, a technique that assesses for incorrect placement in a blood vessel when giving an intradermal injection. The injection site is not massaged. Which of the following family members exposed to tuberculosis would be at highest risk for contracting the disease? 1. 45-year-old mother. 2. 17-year-old daughter. 3. 8-year-old son. 4. 76-year-old grandmother. The correct answer is 4. Elderly persons are believed to be at higher risk for contracting tuberculosis because of decreased immunocompetence. Other high-risk populations in the United States and Canada include the urban poor, clients with acquired immunodeficiency syndrome, and minority groups. A client has a positive reaction to the Mantoux test. The nurse interprets this reaction to mean that the client has 1. Active tuberculosis. 2. Had contact with Mycobacterium tuberculosis. 3. Developed a resistance to tubercle bacilli. 4. Develop passive immunity to tuberculosis. The correct answer is 2. A positive Mantoux skin test indicates that the client has been exposed to tubercle bacilli. Exposure does not necessarily mean that active disease exists. A positive Mantoux test does not mean that the client has developed resistance. Unless involved in treatment, the client may still develop active disease at any time. Immunity to tuberculosis is not possible. The nurse should caution sexually active female clients taking isoniazid, INH, that the drug has which of the following effects? 1. Increases the risk of vaginal infection. 2. Has mutagenic effects on ova. 3. Decreases the effectiveness of hormonal contraceptives. 4. Inhibits ovulation. The correct answer is 3. INH interferes with the effectiveness of hormonal contraceptives, and female clients of childbearing age should be counseled to use an alternative form of birth control while taking the drug. INH does not increase the risk of vaginal infection, nor does it affect the ova or ovulation. The nurse should include which of the following instructions when developing a teaching plan for a client who is receiving isoniazid and rifampin for treatment of tuberculosis? 1. Take the medication with antacids. 2. Double the dosage if a drug dose is missed. 3. Increase intake of dairy products. 4. Limit alcohol intake. The correct answer is 4. Isoniazid and rifampin is a hepatotoxic drug. The client should be warned to limit intake of alcohol during drug therapy. The drug should be taken on an empty stomach. If antacids are needed for gastrointestinal distress, they should be taken 1 hour before or 2 hours after the drug is administered. The client should not double the dose of the drug because of potential toxicity. The client taking the drug should avoid foods that are rich in tyramine, such as cheese and dairy products, or he may develop hypertension. The nurse is providing follow-up care to a client with tuberculosis who does not regularly take the prescribed medication. Which nursing action would be most appropriate for this client? 1. Ask the client's spouse to supervise the daily administration of the medications. 2. Visit the client weekly to verify compliance with taking the medication. 3. Notify the physician of the client's noncompliance and request a different prescription. 4. Remind the client that tuberculosis can be fatal if it is not treated promptly. The correct answer is 1. Directly observed therapy can be implemented with clients who are not compliant with drug therapy. In DOT, a responsible person, who may be a family member or a healthcare provider, observes the client taking the medication, visiting the client, changing the prescription, or threatening the client will not ensure compliance if the client will not or cannot follow prescribed treatment. A 4-year-old has been scheduled for a cardiac catheterization to help prepare the family. The nurse should 1. Advise the family to bring the child to the hospital for a tour a week in advance. 2. Explain that the child will need a large bandage after the procedure. 3. Discourage bringing favorite toys that might become associated with pain. 4. Explain that the child may get up as soon as the vital signs are stable. The correct answer is 2. The catheter insertion site will be covered with a bandage. This is important for preschool children to know, as they are very concerned about bodily harm. The best time to prepare a preschool child for an invasive procedure is the night before. Bringing a favorite toy to the hospital will help decrease the child's anxiety. To prevent bleeding, the child will be expected to keep the extremity straight for 4 to 6 hours after the procedure, either in bed or on the parent's lap. When developing the discharge teaching plan for the parents of a child who has undergone a cardiac catheterization for ventricular septal defect, which of the following should the nurse expect to include? 1. Restriction of the child activities for the next 3 weeks. 2. Use of sponge baths until the stitches are removed. 3. Use of prophylactic antibiotics before receiving any dental work. 4. Maintenance of a pressure dressing until return visit with a primary healthcare provider. The correct answer is 3. Prophylactic antibiotics are suggested for children with heart defects before dental work is done to reduce the risk of bacterial infection. Typically, activities are not restricted after cardiac catheterization. A percutaneous approach is used to insert the catheter, so stitches are not necessary. Showering or bathing is allowed as usual. The pressure dressing will be removed before the child is discharged. An 18-month-old with congenital heart defect is to receive digoxin twice a day. The nurse should instruct the parents about which of the following? 1. Digoxin enables the heart to pump more effectively with a slower and more regular rhythm. 2. Signs of toxicity include loss of appetite, vomiting, increased pulse, and visual disturbances. 3. Digoxin is absorbed better if taken with meals. 4. If the child vomits within 15 minutes of administration, the dosage should be repeated. The correct answer is 1. Digoxin's effect is to slow the rate of the electrical conduction to the heart and increase the strength of the heart's contraction. Signs of toxicity include anorexia and decreased heart rate. Digoxin should be taken 1 hour before meals or 2 hours after meals in order to obtain better absorption of the drug. If the child vomits within 15 minutes of administration, the dose should not be repeated because it is not known how much of the medication has been absorbed. A child diagnosed with tetralogy of Fallot becomes upset, crying and thrashing around when a blood specimen is obtained. The child's color becomes blue and the respiratory rate increases to 44 breaths per minute. Which of the following actions should the nurse do first? 1. Obtain a prescription for sedation for the child. 2. Assess for an irregular heart rate and rhythm. 3. Explain to the child that it will only hurt for a short time. 4. Place the child in a knee to chest position. The correct answer is 4. The child is experiencing a hypercyanotic or hypoxic episode. Therefore, the nurse should place the child in a knee to chest position. Flexing the legs reduces venous flow of blood from the lower extremities and reduces the volume of blood being shunted to the interventricular septal defect and the overriding aorta in the child with tetralogy of Fallot. As a result, the blood then entering the systemic circulation has higher oxygen content and dyspnea is reduced. Flexing the legs also increases vascular resistance and pressure in the left ventricle. An infant often assumes a knee to chest position in the crib, or the mother learns to put the infant over her shoulder while holding the child in a knee to chest position to relieve dyspnea. If this position is ineffective, then the child may need a sedative. Once the child is in the position, the nurse may assess for an irregular heart rate and rhythm. Explaining to the child that it will only hurt for a short time does nothing to alleviate the hypoxia. When assessing a child after heart surgery to correct tetralogy of Fallot, which of the following should alert the nurse to suspect a low cardiac output? 1. Bounding pulses and mottled skin. 2. Altered level of consciousness and thready pulse. 3. Capillary refill of 2 seconds and blood pressure of 96/67. 4. Extremities warm to the touch and pale skin. The correct answer is 2. With a low cardiac output and subsequent poor tissue perfusion, signs and symptoms would include pale, cool extremities, cyanosis, weak, thready pulses, delayed capillary refill, and decrease in level of consciousness. An infant weighing 9 kilograms is in the pediatric intensive care unit following arterial switch surgery. In the past hour, the infant has had 16 milliliters of urine output. Which action should the nurse take? 1. Notify the primary healthcare provider immediately. 2. Record the urine output in the chart. 3. Administer a fluid bolus immediately. 4. Assess for other signs of hypervolemia. The correct answer is 2. Urine output for an infant weighing 9 kilograms should be 1 milliliter per kilogram per hour. 16 milliliters of urine output is more than adequate for 1 hour, so the nurse should record the output in the chart. There is no reason to notify the primary health care provider regarding adequate urine output. The infant has adequate output, so there is no need for a fluid bolus. A fluid bolus could also cause the infant to become fluid overloaded, increasing the workload on the heart. There is no information in the question indicating that the child is hypervolemic. As part of the preoperative teaching for the family of a child undergoing a tetralogy of Fallot repair, the nurse tells the family upon returning to the pediatric floor that the child may 1. Be placed on a reduced sodium diet. 2. Have an activity restriction for several days. 3. Be assigned to an isolation room. 4. Have visits limited to a select few. The correct answer is 1. Because of the hemodynamic changes that occur with open heart surgery repair, particularly with septal defects, transient congestive heart failure may develop. Therefore, the child's sodium intake typically is restricted to 2 to 3 grams per day. Activity restrictions are inappropriate. Typically, the child is encouraged to walk the halls and unit. Risk for infection after the repair is the same as any postoperative client. Therefore, isolation is not necessary. The child may be placed in a room with other children who are not contagious. Visitors are not restricted unless the pediatric unit has restrictive visiting policies. The mother of a child hospitalized with tetralogy of Fallot tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue. A 32-year-old multigravida returns to the clinic for a routine prenatal visit at 36 weeks gestation. The assessments during this visit include BP 140 over 90, pulse 80, and +2 edema of the ankles and feet. What further information should the nurse obtain to determine if this client is becoming preeclamptic? 1. Headaches. 2. Blood glucose level. 3. Proteinuria. 4. Edema in lower extremities. The correct answer is 3. The 2 major defining characteristics of preeclampsia are blood pressure elevation of 140 over 90 or greater and proteinuria. Because the client's blood pressure meets the gestational hypertension criteria, the next nursing responsibility is to determine if she has protein in her urine. If she does not, then she may be having transient hypertension. The edema is within normal limits for someone at this gestational age, particularly because it is in the lower extremities. The preeclamptic client will have significant edema in the face and hands. Headaches are significant in pregnancy-induced hypertension, but may have other etiologies. The client's blood glucose level has no bearing on a preeclampsia diagnosis. A 29-year-old multigravida at 37 weeks gestation is being treated for severe preeclampsia and has magnesium sulfate infusing at 3 grams per hour. To maintain safety for this client, the priority intervention is to 1. Maintain continuous fetal monitoring. 2. Encourage family members to remain at bedside. 3. Assess reflexes, clonus, visual disturbances, and headache. 4. Monitor maternal liver studies every 4 hours. The correct answer is 3. The central nervous system functioning and freedom from injury is a priority in maintaining well-being of the maternal fetal unit. If the mother suffers CNS damage related to hypertension or stroke, oxygenation status is compromised and the well-being of both mother and infant are at risk. Continuous fetal monitoring is an assessment strategy for the infant only and would be of secondary importance to maternal CNS assessment because maternal oxygenation will dictate fetal oxygenation and well-being. In preeclampsia, frequent assessment of maternal reflexes, clonus, visual disturbances, and headache give clear evidence of the condition of the maternal CNS system. Monitoring the liver studies does give an indication of the status of the maternal system, but the less invasive and highly correlated condition of the maternal CNS system in assessing reflexes, maternal headache, visual disturbances, and clonus is the highest priority. Psychosocial care is a priority and can be accomplished in ways other than having the family remain at the bedside. After instructing a preemie-gravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus, the nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. When teaching a multigravida client diagnosed with mild preeclampsia about nutritional needs, which of the following types of diet should the nurse discuss? 1. High-residue diet. 2. Low-sodium diet. 3. Regular diet. 4. High-protein diet. The correct answer is 3. For clients with mild preeclampsia, a regular diet with ample protein and calories is recommended. If the client experiences constipation, she should increase the fiber in her diet, such as by eating raw fruits and vegetables and increase fluid intake. A high-residue diet is not a nutritional need in preeclampsia. Sodium and fluid intake should not be restricted or increased. A high-protein diet is unnecessary. A preemie-gravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated, although the application of cool compresses may ease the pain temporarily. This would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. The primary healthcare provider prescribes intravenous magnesium sulfate for a preemie gravida client at 38 weeks gestation diagnosed with severe preeclampsia. Which of the following medications should the nurse have readily available at the client's bedside? 1. Diazepam. 2. Hydralazine. 3. Calcium gluconate. 4. Phenytoin. The correct answer is 3. The client receiving magnesium sulfate intravenously is at risk for possible toxicity. The antidote for magnesium sulfate toxicity is calcium gluconate, which should be readily available at the client's bedside. Diazepam, used to treat anxiety, usually is not given to pregnant women. Hydralazine would be used to treat hypertension, and phenytoin would be used to treat seizures.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.